Hello friends, and welcome to this special video in which I'll be talking about letters of recommendation for residency application. If you think that letters of recommendation are just one of these documents you submit for your ERAS application, you're totally wrong. Letters of recommendation might be the most important part that program directors look at when assessing your application. In this video, we'll go over some of the most important tips that you need to know as a residency applicant about letters of recommendation, and at the end we'll go over an example of an excellent letter of recommendation or LOR so you see how a good one looks like. Before we get started, I have a big surprise for you. I'll be giving you access to free samples of letters of recommendation, so stick until the end of this video so you get access to these samples. The first question I want to answer is, should I waive my LOR? And the answer is definitely waive your right to see the LOR. And for those who don't have a background on what that means, waiving the letter of recommendation means you don't get to see the letter of recommendation before you send it to residency programs. So the old days, you used to ask someone to give you a letter of recommendation, you take that LOR and then you submit it yourself to the ERAS or to residency programs. However, now you can waive your right to see the LOR. So the person writing the LOR can submit it directly without you seeing it, which means you have to trust what people are saying about you without seeing that. So in the old system, if you see the LOR and you see something that you don't like, you probably won't submit that LOR. But now you won't see it if you waive your right. So that means program directors would value the LORs more because you trust what people say about you without you seeing it. That's why I highly recommend you check that box that you waive your right to see the LOR. And that brings me to my next question, which is you have to be now very careful about who should you ask to write your LOR. And I get asked about this question a lot. I'm working with the program director, I'm working with the chair, should I ask them for a letter of recommendation? The most important part, in my opinion, and so many others I've asked, is how closely you've worked with the person writing your LOR. If there is a program director or chair and you've worked with them for 2 out of 30 days on your observership or rotation, it might not be the best idea to ask them for the LOR. It's better to ask in this situation the person you worked with the most, because even if the program director or the chair who you worked very little, they agreed to write the LOR for you, it's probably gonna be a very generic LOR. Also, you yourself have to ask specifically, will you be willing to write me a strong letter of recommendation? Because not everyone is willing to do that, not everyone knows how to do that. So you have to ask your colleagues, your residents, about the author's reputation of writing strong LORs, and you have to ask you yourself very specifically, are you willing to write me a strong letter of recommendation for my residency application? And those who are not willing to write you a strong LOR will tell you, no, I don't feel comfortable, I don't think I've worked with you close enough. So they'll apologize if they're not willing to do that. And that would leave you with the people who are willing to really support your residency application. Because the last thing you need on your residency application is a mediocre or bad letter of recommendation. Another common question is, should I submit LORs from another specialty? Let's say you're applying for internal medicine and you have multiple LORs. So should you use LORs from your surgery rotation or pediatric rotation? And the answer is, I highly recommend you submit letters of recommendation from the specialty that you're applying to. So if you're applying for IM, focus on IM letters. If you're applying for surgery, get all your LORs from surgery. However, sometimes applicants don't have enough letters of recommendation from that specialty, and in that case, you have no option. But if you had the option, I highly recommend you submit all your LORs from the same specialty. And that is a mistake I see many applicants make, especially international medical graduates, is that they don't have enough LORs from the specialty they're applying to, because they apply to 2 or 3 specialties and they go and do one observership in pediatrics, one observership in anesthesia, surgery, internal medicine, because they want to apply to multiple specialties and increase their chances of matching. But because of that, they only get one LOR from each specialty and they won't have a strong application for any of the specialties that they're interested in. So that's why when you strategize to apply for the match, make sure that you're investing your time in the specialty you're interested in, so you build a comprehensive application around that specialty. Now, another common question, especially for international medical graduates, is, should I use LORs from outside the US? I personally highly recommend using US LORs. Remember, you're applying for residency in the United States, so you need people who are inside the system to testify that you will be able to function during residency in the US. Remember, the main reason why people want LORs is they want to have a surrogate of whether you'll be successful during residency. So if they're for sure, 100% sure you'll be successful, they don't need LORs, they don't need step scores, they don't need anything. If they're for sure know that you'll be successful in residency, but the reality is they don't, and they need some surrogate surrogates of other people's opinions of your success, passing step 1, passing step 2, to see if you'll be a successful resident. That's why you need a testimony from someone inside the system to testify that you'll be able to succeed in US residency. And healthcare systems across the world vary so much, and that's why a letter of recommendation from India or Pakistan or Egypt or China might not be as strong as an LOR from the US. So if you want to use a letter from outside the US, maybe because you did a full residency training outside the US and you want to get your program director LOR or your chair LOR or something very significant that you've done outside the US, maybe limit it to one, not more than one, and the rest should be from your experiences inside the US. And the final question I want to answer before we move on to look at an example of an LOR: should I write my own LORs? And some people might listen to this and say, how can you write your own LORs? The answer is sometimes mentors in the US are very busy and they don't have the time to write your LOR from beginning to end. So they ask you to write an initial draft of your interactions with them, what you've done with them, and then submit it to them, and they will either remove portions, add portions, maybe not use any of the things that you've written, and then they submit it themselves to ERAS without you looking at it if you waived your right to see the LOR. And that most of the time decreases the work that they have to do for your letter of recommendation, especially that they have to write so many LORs around the same timeline. And the advice I have for you when writing your own LOR is, first, don't be shy. Many applicants, when they're asked to write their own LORs, they write very, superficial things. They don't go into details of describing how amazing they are because they don't want to write great things about them. But that is the opposite of what you should be doing. You should be writing the best LOR about yourself in case your mentor didn't change much in that LOR. And you can ask them before you start drafting your own LOR, how did I perform, so I know how to write the letter or in which tone I can write it, and they can tell you. If they tell you you were amazing, you can write the LOR in that tone. Second, look at the templates that we will provide at the end of this video so you can have an idea of how a good LOR looks like. Third, make sure the LOR is amazing, perfectly written, very nice flow, very nice structure, and ready to be submitted. That doesn't mean your mentor will submit it directly, but you should make it as easy as possible for them to change the LOR and have it ready, which will definitely leave a better impression on them. And if you need help drafting your LOR, discussing it with an advisor, we have a special service dedicated to helping applicants draft their own LORs before they send it to their mentors. And I'll leave the link for that service in the cards above and in the description below. And now let's move on to discuss a sample of a letter of recommendation that we have on our blog. So let's look now at this sample of letter of recommendation that you can find it on our blog. So if you go to our blog, thematchguide.com/blog, and you'll find this sample here under the match application blogs letter of recommendation. So it starts with, dear program director, I'm writing this letter of recommendation in support, and they mention the name of the applicant who's applying to this year's IM match, and then they talk a little bit about the applicant and how amazing they are, and then they talk about how they met the applicant. That's a very crucial part of the LOR, and that can tell the difference between someone who you worked closely with versus someone who you worked with for a day or two on like a rotation or research. So that's why I recommend you ask someone who you worked with closely, who can testify to your relationship and how great you are clinically or in research, rather than someone you met online, or you've done a remote research project with, or just like a 1-2 day interaction. That can leave a different impact on the person reading the LOR. I've had the privilege of working closely with Shiv during her time at my primary care outpatient clinic in San Diego, where she displayed remarkable dedication, medical knowledge, and commitment to excellence. And you'll find here between the paragraphs a commentary on these paragraphs that you can read on your own. From the outset, Shiv's depth and breadth of medical knowledge impressed me. During her 3-week clerkship at my clinic, she seamlessly integrated herself into the work environment. And this is one of the key factors of an LOR and why some people don't know how to write a good LOR, because you're not gonna just talk about the applicant and how amazing you are. You need to provide proof, evidence of what you're talking about. So if you're saying this applicant is amazing, you have to support it with something. Here, the physician says during her 3-week rotation, she integrated with the team seamlessly. So she was able to be part of the team, although it's a different system for her. She was still able to integrate with the team at his clinic without any issues. And that's very important because you'll be joining residency, you'll be joining a new team. So residency program directors are looking for that type of applicants who can join their team, who can be part of a team, of the residency team, team without any problems. In a short time period, Shiv was actively involved in patient care, performing tasks ranging from taking comprehensive history and conducting physical examination to formulating differential diagnosis and implementing treatment plans. Here the physician starts talking about the skills that Shiv has as an applicant, and of course these skills reflect on residency program. Residency programs are looking for someone who can perform a physical exam, take a detailed history, do differential diagnosis, implement treatment plans. So all the things that will be highlighted in the LOR will reflect somehow in what program directors are looking for. I was particularly impressed by her note-taking skills on our electronic medical system Epic, which she mastered through her own initiative and meticulousness. So own initiative, that's a buzzword for how proactive Shiv was. Probably she didn't have to do it, but she was interested in doing it and she showed the initiative to learn it and she mastered it. Examples like that are what I talk about over and over when mentioning LORs. You don't just say person is hardworking, proactive. I want to see an evidence. I want to see something that reflects what you're talking about, and this is exactly what the person writing this LOR is saying. Now moving on to another very important part of every single LOR is your personality. So some applicants are amazing, they have amazing medical knowledge, great ability to formulate differential diagnosis, treatment plan, but they're not nice people. They can't work with others. They might be rude, they might be perceived as not nice. So commenting positively on your interactions with people is key in every single LOR that comes to personal statements that is addressed for residency programs. So here you can see her colleagues and residents also recognize her hard work and exceptional patient care. Outside of this, both the office staff and resident commented on her positive attitude, can-do personality, and pleasant nature. You see how the LOR author is not saying I had positive interaction with this person. The author is not saying Shiv is nice. The author is saying that residents have worked with her and they kind of told me how amazing she is. How did the author know? Probably the residents told him. How did the author know that the staff are happy with her? Probably office staff told the author how amazing she is, how pleasant she is. So that's a perfect example of how you can demonstrate somebody's personality in a letter of recommendation. Indeed, Shiv's presence in the office was felt so much that I have even had several patients ask for updates on Dr. Shiv since her rotation with us. Imagine yourself in the shoes of a program director. Would you like to interview someone like that? For me, definitely yes, because it's portraying that applicant in a great manner, not only on the medical knowledge side, but also on the personality side, and all that through experiences. That's what I'm talking about when I say you have to demonstrate your skills and your characteristics through experiences, not just someone is nice, someone is hardworking. And that's why we have this letter of recommendation editing service, because a lot of applicants don't know how a good LOR looks like. They need help with that. They need help in demonstrating these interactions, these skills that they have to shine through their LORs. The match process is very expensive, applying to programs, flying to places, interviewing. You don't want to mess up your chances because you didn't have a good LOR or a good personal statement or a good CV. And the good news is that we have all these services for you. We have bundled them in a package called the Match Application Package. I'll leave the link for that in the cards above and the description below. And another amazing thing is that we have a free 10-minute consultation service in which you can ask any question about our services for free. So you won't be charged anything. Go ahead and ask your questions for free, and I'll leave the link for you to schedule these consultations in the description below. Going back to the LOR, the author now moves to talk about something else, which is research. So the author talked about how they met Shiv. They talked about Shiv's clinical skills, her interactions with the residents and the staff and the patients, and now they want to talk about research. Furthermore, Shiv's enthusiasm extended beyond clinical rotations. Following her time at my clinic, she expressed a desire to engage in research activities. I connected her with Dr. Jim Smith, a respected colleague studying social determinants of developing pulmonary fibrosis. Shiv worked remotely with Dr. Smith for 6 months, all while completing additional clinical rotations and studying for the 3-step sequence of the USMLE. That shows determination, that she's interested, she showed initiative, she asked to be involved in research, she worked remotely on research while she was doing other things. Her commitment to research and her ability to balance multiple responsibilities were truly remarkable. Now the author goes to talk a little bit about her personality and things outside their interaction with her. In addition to her exceptional achievements, Shiv's personal qualities further distinguish her. She's an incredibly compassionate individual with strong family values. Shiv's commitment to supporting her family in India is evident in her willingness to work a second job as a food delivery driver alongside her full-time responsibilities in the lab. This resilience and empathy demonstrate her determination to overcome challenges and her unwavering dedication to helping others. So This is not necessarily reliant on the author interacting with the applicant, but it still shows an amazing aspect of the applicant in case the person reading the LOR did not see that in Shiv's application. Now moving on to the final paragraph, and that's usually the paragraph that the authors say this is the best person I've worked with, or the top 1%, top 5% of all the applicant I've worked with, and it summarizes everything in here. Having mentored numerous medical students, residents, fellows, and junior faculty members throughout my career, I can confidently assert that Shiv Roy is a generational talent. Her potential for success is truly outstanding. I hold no reservation in providing my highest recommendation for Shiv as an applicant in this year's internal medicine match. She is my top choice, and I firmly believe that she will bring great honor to your institution. This end cannot be better. You see all the superlatives such as highest recommendation, generational talent, outstanding, my top choice, which is only said to one person. And that is the main reason why I always say you need to get an LOR from someone who knows you well and will support you as hard as they can. And now I'll show you how to get the free LOR samples I told you about at the beginning of this video. If you go to our website, thematchguide.com, look at the primary menu and you'll see free resources. You'll have so many free resources available. The ones related to the match are mainly ERAS application template, residency match templates, and the residency roadmap webinars, which are webinars done on a weekly or bi-weekly basis to answer your questions about the match. So the ones that relate to the LOR is this one, residency match templates, and you'll actually get multiple templates in addition to LORs. You'll get templates of letters of interest, letters of intent, personal statement. So make sure to click on this link, follow the prompts, and you'll receive the LOR templates to your email. And by the way, if you're applying to the match this cycle, don't forget to watch my ERAS application tutorial. It's a full 1-hour tutorial that goes step by step on how to fill your ERAS application. Thank you everyone so much for watching, and good luck on your match.